If you're well-informed, you can execute better. And PRM systems with market intelligence tools can get you more informed. So it's great. We can show screenshots. People are excited. You wish you had this information. The real question is, does this really work in the real world? Well, let me pose this question. What if your outreach organization could report an amazing amount of revenue growth, from $680,000 to $6.5 million? What if that was from one sub-service line, a focused effort? Well, here's a case study. An organization found underperformance in a very specific sub-service line related to blood cancer and bone marrow transplant. Using market intelligence, they identified 23 high-referring providers, meaning providers that had a reasonable incidence of this particular type of patient. What they did is they developed a strategy against those providers, not against per se, but really to actually engage with them. They chronicled in a PRM system 140 outreach visits. They were able to see 61 new patients, totaling 500 plus new encounters. And down at the bottom, you can see the revenue results. A net change of $5.8 million, 2.6 of that coming from existing referring providers who might have been leaking other business. 3.1 million coming from providers who may have been overweighted in preferring another organization, a competing organization, but that they started to gain referrals from their competition. And in studying the market, they also decided to expand the reach a little bit of where they wanted to go with these outreach visits, and they started to see a return on that effort as well. Pretty exciting and certainly high dollar and certainly justifying of the investment and expense, and really it is investment, although some might look at it as an expense, in a physician outreach organization and the technology to hold that organization accountable. Now clearly, not every opportunity is going to be worth millions of dollars. But pose this question to yourself. Do you have the potential for 50 opportunities that might be worth $30,000 each? Just a few referrals redirected from certain providers, just a few cases brought in by splitter surgeons or interventionalists. Most of you, I think, would answer and say, if I knew that I had 50 plus of these opportunities and I knew how to go after them, I could return that value to the bottom line because I have good relationships with my physicians. We are essentially talking about superpowering those relationships.